Hello, everyone. This is my disease on the pathophysiology of Lyme disease for our class. We'll go ahead and jump right into it. First, starting off, what is Lyme disease? So Lyme disease is the resulting infection of the bacterial spirochete Borrelia burgdorferi. It's transferred to humans from humans and animals via the bite of specific species of tick. The Lyme disease is the most common vector-borne illness in North America, Europe, and Asia. And once bitten, humans can experience a multitude of symptoms, usually starting with the telltale bullseye and then leading to systemic disease processes that can eventually cause severe disability and other compounding disease. This presentation will basically inform about Lyme disease, how it enters the body, its manifestations, and some more. We're not going to cover all that in this presentation, but you'll just get a feel for what the presentation is about. Starting off, we go through epidemiology and the prevalence of Lyme disease, mainly focusing on the United States. It's the Northeast, Mid-Atlantic, and Upper Midwest areas. As vector-borne illness, there's no higher prevalence among certain cultural, racial, or ethnic groups. The highest case lies with those who spend an inordinate or abnormal amount of time outdoors compared to the general public. So this will be people who are in the profession of being outdoors, park rangers, people who are gardeners, things like that, and people who spend a lot of time outdoors for recreation, so hikers and the like. Also, a lot of people who are children, pediatric populations aged 5 to 15 make up the majority of Lyme cases in the United States. A lot of kids are stooping in the ground and picking up Lyme ticks and stuff like that. The way that ticks are transferred from nature to the human body is usually by brushing up against something, as ticks don't really have a large locomotive pattern. They don't have big legs to get them places. So they brush up against them and then it touches the skin and they get bit. Of the total number of Lyme cases, there's a slight prevalence towards women. A lot of that is because of misdiagnoses, usually through being misdiagnosed fibromyalgia, depression, and possibly fatigue syndrome. There's only 9 cases reported between 1985 and 2018 of deaths from Lyme disease. It's very uncommon. Mostly Lyme disease results in more long-term disability and complex disease processes. Total of 208,000 Lyme cases per year. There could be more. It's kind of up to the CDC. They talk about how a lot of cases are misdiagnosed and potentially that they're not being reported as much, but I think that's the case with a lot of diseases in the United States. So where does Lyme disease come from? As discussed, it's from the bacteria Borrelia burgdorferi. The bacteria is only carried by a certain species of ticks, that which being the Ixodes species. They're normally called dog ticks or black-legged ticks. And not all of ticks of that species carry Lyme disease, and not all people who are bit by ticks who carry the disease end up getting Lyme disease. The pathway for the infection usually goes where a tick is born without the disease. They bite an animal that is already carrying Lyme disease, and then that gets passed on as they bite a human or another animal. It does take time for the disease to actually move from the tick to the animal. It takes about 24 hours after the bite in plants for the bacterial load to make its way from the digestive area of the tick into the mouth and into the host's tissue, which I think is pretty interesting. So it's one of the reasons that prevention and checking for ticks is so important in terms of preventing disease. So once the tick has bitten someone, the bacteria moves into the body. There it begins to replicate rapidly. It's then pushed through the blood, circulatory system, and regular tissue of the body. This is when the person who is infected becomes symptomatic. As we discussed further in this presentation, joint and muscle soreness, fatigue, fever, redness, swelling are very typical parts of the infectious process, but there is 3 stages to the infectious process: 1, 2, and 3. 1 is localized infection, 2 is disseminated, and 3 is a long-term chronic. Like I said, the clinical manifestations, that bullseye rash coming through for that first part, fever. In the disseminated infection, facial nerve palsy, meningitis, fatigues, body aches, a secondary rash. And then in late chronic untreated Lyme disease, there's arthritis in the large joints. In rare cases, there's carditis, encephalitis, and encephalopathy. Long-term complications of this, again, lead to, for diagnostics and treatments, there's blood tests is the main way that they're tested. Unfortunately, there's a lot of complications in terms of how blood tests work for Lyme disease. They have to be very specific, and at certain points, the viral load can be the bacterial load can be not as evident, so it's harder to diagnose. It also mimics a lot of other diseases, so it's often not tested for. Treatment is oral antibiotics or IV antibiotics, depending on the progression of the disease. Complications include carditis, as I talked about before, facial nerve palsy, meningitis. Carditis has the potentially fatal outcome, as it may lead to arrhythmias, heart blocks, further complication from blood clots and embolisms. That's kind of one of the worst case scenarios in terms of how Lyme disease can progress. Other effects have to do with the nerves, and around 28% of all Lyme cases have some sort of long-term arthritis attached to them. For nursing considerations, important to educate how to avoid ticks, how to identify the vulnerable groups, and how to check for ticks. And people who are at risk, it's like we talked about before, people who spend a lot of time outside, and diagnosis can be very difficult. So that's one of the things as a nurse that you have to watch out for, and be keen to listen to people who maybe have traveled to areas that have a high tick population, high Lyme disease population. So in Florida, there's not a lot of ticks, but people come down to Florida from New England and the north part of the Midwest, so they could be bringing tick-borne disease with them. And that's pretty much it. Prevention is key. Watching out for those populations, and then making sure that if Lyme disease is untreated, it can have serious health concerns. Thank you very much.